it's definitely the beginning of this was absolutely very stressful for everybody. And that stress has somewhat decreased over the last few months, but coming back and you have college kids coming back to Middlebury and schools possibly starting back up, so the stress level is gonna start to go right back up, and we're hopefully going to be prepared for whatever comes next. The initial kind of surge was, I would say, overwhelming, because it was something that we've never really experienced. And even now, we're still making changes daily. Usually you have a patient and you understand kind of their diagnosis and exactly how you're going to treat that and what works and what doesn't. But with COVID, it's not like that. So it's really kind of you know, testing things out, see if they work. If they don't, you try something else. But you're also trying to keep that patient as comfortable and as healthy as possible when they could they could decline at any point, and you have to be prepared for that. So just being prepared at all times on the floor was, I think, one of the biggest challenges. We also had a floor full of other patients that we also had to care for. So it just, I think, increased the kind of the cohesiveness of the unit. Making sure that we were on top of everything, and just being ready for really anything at any point in time. When COVID first started, it was really the unknown. So going into a patient room, you didn't know if what you were wearing was going to keep you safe. I would say a lot of people that don't go into the healthcare field, you go into the hospital, you find out that you're taking care of a patient who is positive or is possibly positive. A lot of people wouldn't be walking into that room. And the nurses, the LNAs, the doctors here, it's really patient first oriented, which is I think why we were so successful during this, and hopefully why we'll continue to be in the case of more cases. It's nice being in a small community like Middlebury. We have Porter here, which a lot of the community members really rely on. With the primary care, with the ER, the infusion center, express care, things like that. So it was nice to know that while they rely on us, on a daily basis, that when we were running low on certain things like masks, hand sanitizer, that we could rely on them. And they played a huge role in making sure that we had adequate masks, hand sanitizer, things like that, making sure that people in the community continue to follow the social distancing guidelines, whether or not you see Vermont's doing well currently and has. And I think it has a lot to do with the fact that the people in the community and have been following those guidelines and trying to be as careful as possible. But just because we're not seeing a lot of cases now doesn't mean in the future that we won't. So stopping those social distancing guidelines and such is only going to increase our chances of having another surge.